we'll certainly have more details about that, but I think you have to recognize that if you look at, for example, the first phase that Ontario has put out, we have not closed businesses in the same ways that they have there. We already have people going outside. We already have essential businesses that are working, our construction businesses, and we have put in place, and I've said this many times, the guidance that people need to safely manage those businesses. So yes, we will be looking at the ones that we did shut down and coming out with more details around how they can give us their ideas. You know, I don't know all the ins and outs of every different business, but what I'm providing is what we need to do to be able to open up safely. And we know that works in the retail sector and the grocery sector that we've seen. So there are already in place guidance for people, and we need to continue that to the areas that we did shut things down here in British Columbia over the coming weeks, and we'll have more details on that. Well, I think we all need to be in that, people are paying attention, and we need to be at that point where our numbers are coming down. And today, with 11 new positives, with the amount of testing we're doing, that is a really positive sign. So we're getting to that place, and I think people in British Columbia are waiting to make sure that we're not going too fast and that we're not going to undo all of the important work and sacrifice that we've done in the last few months. And we are putting together, as we've talked about over the last week, the parameters for which we think it is that we need to have in place to make sure that we can open up safely. And I know many of the retail shops that have closed, many of the other facilities that have closed that have not been ordered to close are doing so because they want it to best protect their employees and best protect their customers. So now we need to start thinking about, okay, what is it going to look like within the parameters of being able to continue social distancing, having smaller numbers of people, maintaining the appropriate hand hygiene and cleaning that we need in an environment, not having those meetings, having some hybrids of working at home and working in maybe smaller teams that are in the office or in the facility at different times. And really, really key, and I talked about that a little bit today, is the importance that it is for employers to make it okay for you to stay home if you're not feeling well right now. How important it is to protect your employees, because that protects your business. It also protects their families and our communities, because when people are working sick and they're together and they spread it to each other, they take it home to their families, and their families may work in long-term care or in healthcare. We've seen this happen in the past few weeks. So those are the minds enabling our employees, the people who work in our sector, to stay away if they're ill, or to work from home if they're not feeling well, so that we are maintaining that bubble that we have here in BC and not allowing the virus to spread. So those are the important considerations, and I think people will be ready when we get there. And we're going to be moving along slowly and thoughtfully and safely in the coming weeks.
Again, we're not announcing these issues today, as we said, although obviously all of them are being worked on. I think it's fair to say that of all the things, if there's a hierarchy of measures that are important, not working sick is at the highest level of importance. I think we can all agree with that, and we've seen renewed evidence of that in the last 7 days, of the importance of employers not insisting that people work sick or that workers not working sick. And that is going to be a fundamental change that's really going to be a key part of any strategy that one could possibly think of with respect to dealing with COVID-19 until there's some form of community immunity. I might add that working sick is not a good idea under any circumstances. So you can imagine that will be a significant part of our thinking, how to address that question. But we're not laying out our plan today, but I can tell you what you've identified, not working sick, is a critical part of anything that Dr. Henry or government or anyone else is thinking about, because it's one of the most important things, absolutely important things, that we have to ensure people don't do during a COVID-19 period when there is no vaccine.
The details will be coming. we've been foreshadowing a lot of the important things, including the structure that we will have in place, and the fact that all businesses will, some things will not change. We're not going to go back to having lots of people together in enclosed spaces and having meetings and having those opportunities where people can mix and mingle and transmit this virus amongst each other and then bring it home to their families and their communities. So within those parameters, there is a lot that we can do, and there's a lot that's happening already, and they can be used as a good example for people to think of when we're looking at opening up more businesses in the coming weeks.